Welcome to Nationwide on the network service of the NTA. We thank you for joining us once again. I am Lydia Odije Ochi. We begin with coronavirus reports. At 11 p.m. 14th of April, 11 new cases of COVID-19 have been reported in Lagos State, bringing the total confirmed cases reported in Nigeria to 373. Meanwhile, 99 patients have been discharged with 11 deaths. On Tuesday, United States President Donald Trump ordered the suspension of funding to the World Health Organization while a review is conducted. This announcement came in the middle of a serious pandemic. It is also worthy of note that the U.S. contributes between $400 to $500 million to the World Health Organization annually. Now I have with me in the studio Dr. Usman Galadima, a fellow of International Society of Nephrology and a physician with the University of Abuja Teaching Hospital, Gwagwalada. Doctor, thank you for joining us. You're welcome.
Thank you.
Now, from what we just read out now, should the U.S. government go through with the withdrawal of funds to World Health Organization? What's your view?
Well, as Bill Gates said, it is as dangerous as it sounds, because we're in the middle of a pandemic involving a virus that we don't fully know. As you noted earlier on, U.S. contributes about 15% of the annual budget of WHO. And WHO is the global coordinating authority for international health. So withdrawing that at this point will be inimical to the fight against COVID-19.
Okay.
Yeah.
Now, if they should go ahead with that, what will be the impact globally?
Now, WHO is involved. This is what WHO is set up for, to be able to mitigate against pandemics such as this. And they are involved in so many things in almost all the countries of the world. And they're involved in researches, in, trials, and also helping countries that do not have the wherewithal to fight the disease. So the impact will be huge, because if they are not able to fund these activities, it means the intervention at that level will reduce as well. There will be job losses, researches that are ongoing may be curtailed, and it will generally constrict the space of their intervention globally.
Okay, now how will the benefiting countries now, how will they brace up to that kind of challenge? How do you think they could cope?
Well, there are other contributors to WHO funds, like the Bill and Melinda Gates Foundation and other notable private organizations that are involved also in the funding of WHO. And other member countries also pay what is called access dues to WHO. So it will not stop the activities completely, but I believe it will just curtail it. And but individual nations must look inwards to produce or bring out modalities that can be used in fighting this. We can see, even in our own national context, the contribution from, private individuals and other contributions that we're receiving, including the recent one from the EU.
Okay.
So I believe with all these and our local capacities, we'll be able to mitigate against that.
Okay, away from that now, there have been several thoughts or opinions about how to bury COVID-19. What would be your own opinion or your thoughts on how to handle COVID-19 corpses?
Now, unlike the viral hemorrhagic fevers and these infectious diseases like cholera, dead bodies generally are not infectious, except probably if you have to be involved in an autopsy and then you handle the lungs of the corpse of patients that die from COVID-19. So NCDC actually has a guideline for burial of guidelines for health workers, morticians, and families of patients that are deceased from COVID-19. Generally, what has been advised is minimal handling. Okay, there must be, of course, the use of standard precautions. You know, if you have such a corpse, either in the hospital or in the hospital setting, or at home, because sometimes, you know, people tend to, some cultural practices or religious practices, people other than those specifically trained to handle corpses may be involved in that. So, first of all, for the individual handling the corpse, must observe the standard precautions, yes, for infection prevention and control. That is the use of face mask or face shields, the use of hand gloves, and proper or appropriate PPE to prevent contacts. And then the corpse itself, you know, if it's in the hospital settings, all orifices, that is all areas that, you know, you could have secretions oozing from, should be properly secured. And then the bottom line is minimal handling. Okay. And if it's in either funeral homes or either in some non-hospital setting, same is applied. Okay. You know, use of gloves, use of face mask or face shield, and wearing an apron that cannot be soaked by water, and generally minimal handling. Okay. All right. If there will be need for family members to see the corpse, few of them, again with face mask and hand gloves, and also washing of hands after that.
Definitely. Yes. Yes. Now, maybe on our final question, we want you to share your thoughts on the opinions being shared from patients who have other health challenges, saying that attention has shifted from them. Is that true?
Well, the activities in the hospital has been scaled down, and this is based on advice from the infection prevention and control units of the different hospitals. And this is because the transmission of the virus will thrive in any place there's gathering of people. Okay. So activities generally had been scaled down. Okay. But those with chronic diseases cannot be forgotten, really. If they have challenges, most emergency outlets of the hospitals are still open, and they can access care through that. Okay. But, you know, what we'll advise is that if those with hypertension or diabetes, if they can have home monitoring devices, you know, like the blood pressure measuring device or glucometer for checking of their blood regularly, and then continuing on the prescribed medications, you know, unless it is necessary or they experience some problems that will necessitate them to go to the hospital, is advised that they stay at home and monitor these conditions.
Thank you very much for coming on Nationwide. We really appreciate it.
You're welcome.
We've been talking to Dr. Usman Galadima, a fellow of International Society of Nephrology and a physician with the University of Abuja Teaching Hospital, Gwagwalada. Thank you.
You're welcome.
The FCT administration has commenced a community active case search through sensitization and collection of samples to test for COVID-19. Hakimat Ali reports from Pape, Community of Buhari Area Council, which is the first point of the exercise in Abuja.
This exercise is a community active case search, which is being conducted by the Public Health Department of the FCT Health and Human Service Secretariat. This involves screening of anyone who has a history of cough, catarrh, chest pain, or difficulty in breathing. And this is to detect persons who might have COVID-19, to get them promptly treated and break the chain of transmission.
Some of these people that are infected in the city center have their house girls, house boys, security men, drivers living in this environment. So they might be high risk, because when you look at it, they are naturally high risk because of the infection. And for you to get them, you need to go to the community where they stay.
However, the team here, as I've noticed, apart from getting the samples to be tested, they also had to deal with convincing the people on the need to get these tests done.
They prefer them to have palliative than to come and do a test.
I feel the need because I'm enlightened. A lot of people say the test is not important because what is their basic need now is food.
The exercise is expected to be extended to other area councils and community. From Pape, Hakimat Ali, NTA News.
Let's now hook up with our correspondent, Onengie Fineface, on level of compliance by sellers and buyers in some markets with order by the FCT administration to close markets by 2 p.m. on days set aside for residents to restock. So, Onengie, what are your findings? Onengie, what are your findings?
At the moment we're here in Wuse Market, we observed that traders were forced out of the market a few minutes past 2 o'clock by officials of the market union. We noticed that there are so many persons, but they enforced that compliance with the 2 o'clock deadline to make sure nobody is left in the market. The chief security officer of the market was seen with his personnel going around the old stalls to ensure that no trader is left behind. And at the moment, from what we can see around, all these stalls are closed. No single shop is opened in this market right now. One of the officials is here to also throw some kind of light on how they were able to achieve this level of compliance. Your name and how we were able to achieve the compliance.
My name is Innocent Amechina. I'm the Corporate Affairs Manager of Abuja Markets Management Limited, the managers of this market.
So how were we able to achieve this level of compliance in this market?
Yes, it's all about collaboration with government agencies and the traders as well. And the good thing is that the people of Wuse Market, the traders, they appreciate all the effort that government is making to see that we flatten the curve in the FCT. And we encourage them, we sensitize them, we talk to them always. And once it is 2 o'clock, everybody knows that it is time to pack up and go. So even 30 minutes before the time, they are already packing, so that by 2 p.m., anybody that is in the market will have to be forced out, like you said. Okay, so you don't expect 100% compliance. That's why you have to see some people being helped out of the market.
Well, thank you very much. Now, the situation in Wuse was not exactly the same in some other markets we had visited earlier. Around area 1, we observed that as soon as people noticed the presence of NTA, the operatives started asking people to leave the shopping complex. Probably they thought NTA was going to expose them, so they started asking people to leave. We also noticed that there was no compliance with social distancing protocol. The same played out around the UTC area, where we saw people going underneath the gate to access the market. Although it was locked, we still saw some traders display their wares in the locked market.
Onengie, so far, what has been the role of security agents in ensuring this compliance?
Well, for this particular market, there is a popular junction, the Wuse junction. Before even NTA could get through that, it took a lot of time. We had to wait for some vehicles ahead of us to be cleared. I think the check now is more intense. The security operatives are a little more serious in enforcing the compliance. A lot of vehicles were not allowed to the entry point into the market. Of course, we were using a branded official vehicle, so we had access. But then it took a lot of time before those ahead of us were cleared for us to be able to have our own way to the market. But then something else you observed, we've not seen people forced back, by security operatives. It's more or less they check you, they clear you. So one begins to wonder if everybody on the road is on essential duty.
Thank you, Onengie, for that situation report. Thank you so much. Now, let's take our next report just reaching us. It says, fire has gutted Dugbe Alao, a popular market at the heart of Ibadan, destroyed property worth millions of naira. Men of Oyo State Fire Service already at the scene are working to rescue people and put off the inferno. It's time for us to go on a break. Nationwide continues shortly.
This is not a joke. It is a matter of life and death. Mosques in Mecca and Medina have been closed. The Pope celebrated Mass on an empty St. Peter's Square. The famous Notre Dame Cathedral in Paris held Easter Mass with less than 10 people. India, Italy, and France are in complete lockdown. Other countries are in the process of following suit. We cannot be lax.
Illegal oil refineries are devastating. Crude oil theft is criminal. Oil spill due to vandalism is dehumanizing. Piracy is inimical to the economy and international trade. From the creeks of the Niger Delta to the Atlantic Ocean, inland waterways and beyond, the activities of criminally minded Nigerians and their foreign collaborators have hampered Nigerian economic growth, constituted health hazards, and environmental degradation. The Nigerian Navy is poised to put a stop to these activities. Remember, the harmonized standard operating procedure in the maritime sector for optimal benefits of the nation's economy is fully operational. The Nigerian Navy will leave no stone unturned to ensure defaulters face the full wrath of the law. Ignorance of the law is no excuse. Be one. Support the Nigerian Navy. Onward together.
Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Dear brothers and sisters, in view of the COVID-19 pandemic we are currently challenged with, we at Al-Habibiyya Islamic Society enjoin all Muslims to adhere strictly to government directives geared towards stopping the spread of the virus. These measures include the stay-at-home order, washing of hands with soap and water, using hand sanitizers where water is not available, and other hygiene measures. We remind you all of the words of Allah in the Holy Quran, chapter 2, verse 195, which says, "And do not throw yourselves with your own hands into destruction." We also remind you of the hadith of the noble prophet Muhammad, peace be upon him, which says, "Do not cause harm or return harm." Please stay at home and stay safe with continuous dua. This message is from Project Itfine of Al-Habibiyya Islamic Society. Al-Habibiyya Islamic Society, from Allah to you, a light.
Welcome, dear. Have you washed your hands?
Inside my house again. This thing not the key black man.
I don't know if it's misinformation or poor hygiene that will kill you first. Coronavirus is real, and good hygiene practice will save your life. Anyway, no hand washing, no eating.
I will not take care of it. How's one of the parents?
virus is real and it's on the rise. But you can help yourself and help others to be safe. Remember, we can stop the spread. It's in your hands.
This message is from the Akinfade Foundation in partnership with the National Orientation Agency with support from MacArthur Foundation.
Thanks for saying. We now join Lagos for happenings in that zone, and Ruth will be our guide.
Thank you, Lydia. Lagosians have commended the lockdown initiative of federal government to contain the spread of coronavirus. Olumide Guntola reports that residents in some parts of Lagos are eagerly awaiting palliative measures which they believe had already been extended to some people.
Our drive around some areas of the Lagos metropolis shows the impact of the lockdown initiative of federal government.
Lockdown is good because we can see the pandemic is all over the world. It's by the grace of God that Nigeria has not recorded the high side of it.
As I'm talking to you now, I've walked all around the bank. No bank is functioning. My appeal to the government is for at least the bank should function, if not 3 times, 2 times. Let's say 2 days in a week.
In other areas, however, petty traders were transacting business. Evelyn Njoku, another Lagosian, said they had to visit the market to stock their houses after the federal government extended the lockdown for another 2 weeks. Essential workers moved around with ease, and security operatives were on ground to ensure those without appropriate identifications stay off the roads. For now, taking responsibility by maintaining high level of personal hygiene and staying indoors, experts say, is a priority of all in the war against coronavirus COVID-19. In Lagos, Olumide Guntola, NTA News.
In support of the presidential lockdown extension order, the 81 Division of the Nigerian Army has embarked on Operation Checkmate at various locations in Lagos State, where 7 fake soldiers were arrested. Enel Joadiku has more.
Presidential lockdown to curb the spread of coronavirus COVID-19 is essentially to encourage social distancing and identify those with the virus. So staying indoors is a vital part of the process, except for workers who provide essential services. These suspects, for instance, 7 in numbers paraded by the GOC 81 Division of the Nigerian Army, were arrested for impersonation.
These miscreants who have been using military uniform to carry passengers during this lockdown. We'll continue to sanitize the society. We'll continue this operation until we restore normalcy. Not necessarily for them, but for some of our own personnel too, who are misbehaving and carrying passengers. These are pure civilians using military uniform to commit crime.
The suspects were arrested in different parts of Lagos State by Operation Checkmate, an arm of the 81 Division of the Nigerian Army. The GOC advised members of the public to be vigilant at all times and to report any suspected criminals to the law enforcement agencies. He added that after profiling the suspects, they will be handed over to the police for prosecution. In Lagos, Enojo Adiku, NTA News.
We have more stories for you on Nationwide with Lydia in Abuja.
Many thanks, Ruth. Osun State Governor Boyega Oyetola announced 2 weeks extension of the ongoing total lockdown to contain the spread of coronavirus in the state. This was during a broadcast to the people of the state. And the lockdown was, however, relaxed for people to restock between today and tomorrow being Thursday. Let's now join via telephone Chief Press Secretary to Osun State Governor Ismail Omipidon to give more insight into the extension. Welcome to Nationwide.
The pleasure is mine. Good evening.
Okay, so go ahead. Why was the extension extended?
Well, the extension was necessary because we realized that the gains we have recorded in the last 2 weeks was necessitated by the lockdown. Don't forget that before we received the Ivory Coast returnees, which later shot up the number of cases in our state, we had just 2 cases. And from the time we locked down up to yesterday, when Mr. Governor spoke to the people of the state to relax the lockdown just for 2 days to restock, we had not recorded any case. Okay. So we believe that it is not yet an whole. And so there was need for us to be sure, especially because we are also surrounded by other states where these cases are being recorded.
Okay.
That was what informed our administration
the extension.
To extend our lockdown by 2 weeks.
Okay.
Commencing from midnight tomorrow.
Okay. Now, is there any particular situation in the state that does not support the suspension of the lockdown?
One of the major reasons is that before we recorded our second case, that was before the Ivory Coast returnees. One of the cases we recorded in the state traveled from the state to Lagos, where the case had contact with another case that came in from Japan. And so we felt that if there was lockdown at that point in time, there was no way the person who traveled, let alone bring the virus to our state. And so in an attempt to curb community transmission, we want to be totally sure that as far as the state of Osun is concerned, we do not have a case of community transfer. Okay. And that is why we are going for another 2 weeks.
Okay, now, last week, the state government gave out some palliatives to assist the poor. How did you arrive at those or the beneficiaries that needed this gesture?
What we did last week was to target the needy and the poor. Unfortunately, because of the time we are in now, virtually those who were not very vulnerable before have become vulnerable. And so rather than allow the needy and the poor to access it, virtually everybody came forward for it. However, we are doing another, especially by the committee set up by the state government in the wake of this pandemic, to help collect donations from well-meaning Nigerians, especially from the state and outside the friends of the state. I would believe that the next set of will reach the. Don't also forget that apart from the food items that were shared, the conditional cash transfer, which is also targeted at the pandemic, is also going. Majority of them have received theirs.
All right. Okay.
There's a register for that.
Okay. Thank you so much for joining us on Nationwide. We've been talking to the Chief Press Secretary to the Osun State Governor, Ismail Omipidon, giving more insight into the extension of their stay-at-home directive from the governor. The All Progressives Congress has assured Nigerians that the emerging opportunistic crimes that have been recorded in some parts of the country as a result of the coronavirus pandemic lockdown will soon be brought under check. The party's spokesperson, Lanre Issa-Onilu, in a statement says the key responsibility of government remains ensuring the safety and security of lives and property of all citizens, and that the government will continue to take bold steps to secure the country and her citizens from the renewed and intensified Boko Haram counterinsurgency and the enhanced offensive against emerging crimes in other parts of the country. The APC says, in line with the directives of President Muhammadu Buhari during his broadcast on Monday, a major and coordinated offensive by the police, Army, Navy, Air Force, and Directorate of State Services, DSS, is underway against the miscreants. While the government and private concerns are doing their best to provide relief, the governing party believes that all Nigerians have a responsibility to join hands with the security services in protecting themselves and communities from miscreants. The APC is confident that the fight against the global pandemic will soon be won and all will be able to return to their normal lives and activities. Kwara State Magistrate Court sitting in Ilorin has sentenced 3 persons to 1-month community service for violating lockdown regulations as imposed by the government to curtail the spread of COVID-19 in that state. Abdulhafiz Alaya reports that the convicts were tried under Kwara State Infectious Diseases Emergency Prevention Regulations 2020 and Penal Code.
The accused are Amos Philip, Babangida Dontatin, and Baraye Abel. They were arrested by men of the Nigerian Police Force on Tuesday around Sawmill area Ilorin, engaging in commercial activities contrary to the lockdown directive. The accused must explain why they should not be convicted on a 3-count charge of not complying with restriction order, obstruction of a public servant in the line of duty, as well as disobedience to duly promulgated order. They all pleaded guilty as charged and prayed that the court temper justice with mercy. Magistrate Saliu Bio in his ruling convicted and sentenced them to 1 month community service without an option of fine. The convicts are to sweep the premises of the State High Court from 9 a.m. to 1 p.m. every day, beginning from Thursday. What is the implication of this non-custodial sentence? Not leaving anything to chance, anybody coming into the court premises is subjected to thorough temperature check. Sanitary facilities were also put in place in line with COVID-19 prevention regulation. This is the first set of offenders to be arraigned under the State Infectious Diseases Emergency Prevention Regulation 2020. From Kwara State High Court premises, Abdulhafiz Alaya, NTA News.
Kaduna is next and Zille is standing by.
Lydia, welcome to Kaduna. Kaduna State Government says the latest case of COVID-19 in the state, which was from an interstate traveler, reinforces the need to stop all interstate movements. Muhammad Umar Rajingi tells us more about the effects at containing the spread of coronavirus pandemic in the state.
The latest case of coronavirus in the state, which has no connection with the first 5 cases, is that of a man who traveled to Mando area of Kaduna by public transport. The authorities are worried that the case presents a nightmare scenario of possible community transmission of the virus and capable of subjecting about 57,000 persons to risks if adequate measures are not taken to contain it. I asked the Deputy Governor about the readiness of the state to combat coronavirus pandemic.
We have identified an isolation center where mild cases of the coronavirus will be quarantined. Medical personnel to man those places have been identified. That Ministry of Housing using demountable materials.
Contact tracing is on to identify those who came in touch with the seized case, but the Rapid Response Team says people must respect the stay-at-home directive and imbibe all other safety measures. In Kaduna, I am Muhammad Umar Rajingi, NTA News.
In the wake of the coronavirus pandemic, governments at all levels, philanthropists, and many corporate bodies have been coming up with palliative measures to mitigate the effect of the dreaded viral infection on the public. Among such measures in Jigawa State is that of the Nigerian Bar Association that donated essential items to the inmates at Dutse Satellite Custodial Facility. Mansur Aliyu Hassan reports.
Dutse Satellite Custodial Facility, which currently accommodates 76 inmates, was established in 1936. The inmates here and those from other correctional facilities across the country are entitled to a healthy living like any other Nigerian. It is against this backdrop, corporate bodies and other well-meaning individuals have found a way of channeling their resources with a view to cushioning the effect of the global pandemic. Recent among those who donated to the inmates at this satellite facility was the Nigerian Bar Association Jigawa State Chapter.
And there are so many people under detention in these prisons, and some of them are awaiting trial. Then there is need for NBA intervention to see how we can at least offer a solution, either by providing free legal services for them to be released on bail.
The number of instances have been are mostly been reduced from the custody to various places where it will accommodate the number. So as you can see, officially by the capacity of the prison, which is 100, now the number is 75. So certainly we have enough cells to accommodate the inmates.
Items donated include hand sanitizer, bath and washing soaps, detergents, amongst others. In Duse, Mansour Aliyu Hassan, NTA News.
And it's back to Lydia in Abuja for more on Nationwide.
Many thanks, Zile. Niger State government has discharged 27 persons from one of its quarantine centers in Minna, the state capital. Commissioner for Health, Dr. Mohammed Mukunsidi, disclosed this at a press briefing in Minna. Suleiman Kodogi reports.
It would be recalled that the Niger State government last week Monday placed 27 persons on quarantine following their contact with a suspected man that came back from Lagos. The decision of the state government followed the signal received from the family members of the suspect for fear of the unknown. Government tracked down the suspect and the entire occupants of the vehicle and immediately moved them down to the quarantine center where the sample of the suspected person was taken for test to determine the fate of the other 26 persons who had contact with him.
Including them, the result is declared negative, and as such, we have no reason to keep them under quarantine. On that note, we are discharging all of them.
The Commissioner for Health, Dr. Muhammad Malkusidi, explained that out of 11 samples collected from the state, only one tested positive to COVID-19. The remaining 10 tested negative. He appealed to the people to shun fake news and continue to follow the medical advice towards containing and controlling the spread of COVID-19 in the state. Suleiman Kodogi, NTA News.
Mina is standing by in Enugu with more reports on Nationwide. It's over to you.
Thank you, Lydia. Good afternoon and welcome to Enugu. With the reports of the index case of COVID-19 in Anambra State, the state government is not leaving anything to chance as it has prepared for any eventuality. This it did by building and equipping 5 isolation centers spread across the state with capacity to accommodate minor and critical cases of the pandemic. Jane Francis Obi tells us more on the state of the centers.
The state-of-the-art medical facilities in 5 isolation centers, Anambra State government is among states in Nigeria ready to provide effective care in case of COVID-19 in the state. Some of the facilities provided include cardiac monitors, ventilators, central oxygen that supplies intensive care units, chest cardiac pump completion, among others. The Anambra State Commissioner for Health, during a tour of the center, said the state government is working hard to avoid being overwhelmed and emphasizing on prevention.
Here we have 240 beds. There are 3 sections to this place. This is one of the sections. There are 2 other sections. Now, when we talk about patients, if you have a severe patient, we have critical facilities in the state where they will be taken care of, like in General Hospital Nisha, Nanda Azikiwe University Hospital, and Chukwemeka Ojukwu University Hospital in Amako. Now, that is our setup.
Apart from the measures taken, the state government is still emphasizing on good personal hygiene and social distancing to curtail spread of the virus. In Oka, Jem Francis Obi, NTA News.
Traditional rulers in Abia State have mobilized youths in their domain to keep vigil by monitoring entry and exit of people through their boundary communities to check carriers of COVID-19 pandemic, in addition to massive sensitization of their subjects on the pandemic. This, they say, has become necessary in the wake of high rate of persons testing positive to the dreaded coronavirus disease. Dennis Temple reports.
In Abia State, traditional rulers in most communities are so keen about the enforcement of the restriction order by government at various levels to mitigate further spread of COVID-19 pandemic.
I had gone round with my tongue criers, calling for advocacy, calling for understanding, and educating them on this coronavirus.
It's better you stay at home and don't die of hunger. When you stay at home, you won't die of hunger. But when you go out, you die of coronavirus.
We use the churches here in my community to reach out to our populace.
On the lockdown, the traditional rulers expressed satisfaction on the efforts of the government, urging well-meaning sons to complement government efforts.
The moment this thing was told us
I summoned a meeting of both abroad and both at home. And I told them that they should help and not to leave it for the government alone.
Although other states have not recorded any case of COVID-19, but it is expedient that people should adhere strictly to the precautionary measures in order to stem the tide of coronavirus pandemic. In Umuahia, Dennis Temple, NTA News.
And that's a bit from Enugu. Is back to you, Lydia, for a continuation of Nationwide.
Many thanks, Mina. Essential workers in the fight against coronavirus have been commended for their efforts in the front line, with a call for the government to motivate them to do more. Some essential workers who were guests on NTA's Good Morning Nigeria spoke on their challenges as they report for essential duty despite the lockdown. Patricia Esami-Luba has more.
The extension of the lockdown for another 14 days by the federal government to contain the spread of COVID-19 became imperative as cases of new infection are still being recorded in the country. To this end, citizens are still being urged to obey the standing order of stay at home, while essential workers like security operatives, health workers, utility service providers, and journalists continue to render services to make the stay at home more convenient for Nigerians. Guests on the program spoke about the challenges faced by essential workers on duty during the lockdown.
Quite taxing. It's been quite a tax. It's not easy at the time like this, going out there all around, meeting these people. But you know, critical to this fight of COVID-19, it's information, and we can't lay back on that. You need to get the people informed.
As a reporter, you carry the burden of the government in dishing out the information and all the statements that it wants to get across to Nigerians. You also carry the burden of Nigerians who seek clarification on a number of issues. You carry these dual burdens, as it were, and then you have your own burden.
Between the morning hours and then maybe the evening hours when people are closing, they should be taking these essential service workers through their various places. Because even those who have cars, you pass through certain checkpoints. You know, the orientation of the people at the checkpoints also differ. So sometimes they will tell you, oh, you have your health ID card, but you don't have the PTF pass.
On the issue of power distribution, Oyebode Fadipe maintained that the lockdown, which has affected industrial activities, has made it possible for more provision of power supply to homes. He, however, cleared the air on the 2 months waiver of electricity bill for consumers.
Go out, we get reports from all over the country. Customers say, oh, federal government has said don't pay for 2 months. That's not true. Federal government has not said that customers should enjoy electricity for 2 months. If federal government are giving that approval, it's such a major issue that Mr. President would have mentioned it in his last broadcast.
Tweets coming from Nigerians commended the sacrifices of essential workers in the front line of COVID-19 and called for some form of palliatives for those set of persons not covered, with special request that community workers be added to the list of essential workers in the country. In Abuja, Patricia Esami-Luba, NTA News.
You are watching Nationwide on the NTA. Over now to Abubakar in Maiduguri for more stories.
Good afternoon, Lydia, and thanks for joining us. As coronavirus pandemic continues to ravage the global community, Borno State Governor Professor Babagana Umar Zulum has undertaken sensitization talk to the grassroots. Mohammed Goni reports.
The sensitization visit by Governor Babagana Umar will go a long way in enlightening people at the grassroots who may not have any idea about COVID-19. Professor Babagana Umar urged the residents to imbibe the culture of hand washing, observe social distancing, and further advise them to avoid direct contact with visitors from other places through handshake.
As of now, we have not recorded a single case of COVID-19 in Borno State, but nonetheless, we have to be very careful, very apprehensive, so that they should be very vigilant. They should observe all the best practices that have been told to us by the medical doctors with a view to preventing any outbreak in Borno State.
The governor also enjoined them to be prayerful at all times for an end to all calamities, including COVID-19, especially now that Ramadan is around the corner. While joining the global community in the containment of COVID-19, Borno State government also has the challenge of hunger and malnutrition to contend with, as the decade-long insurgency had crippled farming activities. The governor used the visit to distribute food and non-food items to 11,000 households in partnership with Northeast Development Commission and assured to reopen schools in the community as soon as public schools resume in the state. In Maiduguri, Mahmoud Koni, NTA News.
All is now set for the commencement of testing of samples for suspected case of COVID-19 from the Northeast region at the University of Maiduguri Teaching Hospital. A 36-bed capacity isolation center, in addition to protective equipment, are in place and ready for any eventuality that may arise. Yagum Subukar reports.
The University of Maiduguri Teaching Hospital, which is designated by the federal government and NCDC for the testing of samples for any suspected case of COVID-19, has taken bold steps in ensuring proper screening of both staff and patients at the entrance gate. According to the Chief Medical Director, UMTH, Professor Ahmed Ahijo, adequate facilities and consumables to take care of patients are available, with a staff strength of over 100 consultants from various departments, as well as the hospital's Infectious Disease Control Committee working with the state government's response team as proactive measures to curb COVID-19 in the state.
The Nigerian Center for Disease Control has already sent a team. They are installing confirmatory tests for the diagnosis of COVID-19 here in UMTH using the PCR machine.
While commending the strides of government in controlling the spread of the virus, the Chief Medical Director appealed for special intervention to federal teaching hospitals by government in the management and prevention of COVID-19. With these facilities on ground, any suspected sample for coronavirus will be tested and results obtained within an hour. In Maiduguri, Yagum Subukar, NTA.
You're watching Nationwide on the Nigerian Television Authority. Let's now return to Lydia in Abuja for more stories. Good afternoon to you.
Thank you, Abubakar. We'll take another break at this point.
Fellow Nigerians, follow the instructions on social distancing. The irresponsibility of the few can lead to the death of many. Your freedom ends where other people's rights begin. The security agencies have risen to the challenges posed by this unprecedented situation with gallantry, and I commend them. I urge them to continue to maintain utmost vigilance, firmness, as well as restraint in enforcing the restriction orders while not neglecting statutory security responsibilities.
Staying at home is the most responsible thing to do. Please, learn a new skill. Be a better version of yourself. That's what I spend my time doing. Prevention, they say, is better than cure. I beg, make we sit down for house. I know some of us want to get back to socializing, but if we don't sit down for house, no good feel happen. Please, stay safe and stay responsible.
As the world combats the novel coronavirus, also known as COVID-19, the Nigerian government is committing funds and donations are coming from the private sector to tackle the virus. The emergency response to COVID-19 should not be abused as an opportunity for corruption. Do not embezzle the funds. Do not extort money from patients. Observe due procurement processes. And all citizens must guard against the peddling of false information. Do the right thing. Integrity pays. This message is brought to you by ICPC and NTA.
Electricity is part of day-to-day activity. When there is no light, there is no life. It's as if we have been ostracized here. Our children cannot even live normal lives.
Instead of buying things
plenty that will spoil. We are buying it small. For us to go to the market, come, we will spend not less than 250 naira.
Wetin be this coronavirus thing? Na true?
You see this coronavirus wey be COVID-19. Na the whole world palava, and e don dey kill many people for China, Italy, UK, US, Spain, and even for other countries dem.
Okay, wetin come be the reason wey dem say make everybody tanda for house?
Na because if e dey waka pium go carry am from person wey don get am, you go carry come give your family dem. Na so the thing take dey kill other people for other country.
Okay, wetin come be that social distancing sef?
You see social distance. Now make we no come close, because this thing now from air and touch. Now we dey contact am. We suppose dey at least 6 foot away from each other every time.
So okay, no be only to wash your hand and to sanitize them alone.
Make we no take this washing of hand thing take play, but make we come together, join hand as we take pursue Ebola, pursue this coronavirus. Make we be each other be keepers now.
Thank you for staying with us. The Managing Director, Northeast Development Commission, Dr. Mohammed Goni Alkali, has inspected the commencement of construction of first phase of 1,000 houses out of the 10,000 housing units approved by the federal government to fast-track reconstruction, rehabilitation and resettlement program in Borno State. Yagum Subuka reports.
It could be recalled that President Muhammadu Buhari approved the project as part of a comprehensive program to accelerate recovery and process of peace restoration in Borno State. MD, Northeast Development Commission, Muhammad Goni Alkali and his entourage were at Ngom, 1 kilometer by 1.8 kilometer space of land where the pilot project is ongoing. Muhammad Alkali was conducted around the construction site and briefed by Commissioner of RRR, Engineer Mustafa Ali Gubio, on the level of work, where 104 to 125 blocks of the housing units have been formed. Engineer Mustafa Gubio equally explained identification of landowners as well as actual size of plots for proper compensations were also carried out by the Ministry of RRR. NEDC's Managing Director, Goni Alkali, expressed delight over the commencement of the construction of the 1,000 housing units in Gom, acknowledging President Muhammadu Buhari's decisive steps towards ameliorating the sufferings of displaced persons.
As you all know, now we are in a somehow very constrained time because of this pandemic. Yeah. So we're just taking advantage of this short time we have to identify the land and do the clearing so that whenever the situation improves and normality returns, we can start the construction.
He said the construction of the remaining 9,000 houses will commence.
Well, going to our next story now. The Minister of Humanitarian Affairs, Disaster Management and Social Development, Sadia Umar Farouk, has assured Nigerians that the federal government will not condone any lapse in ensuring that beneficiaries of the conditional cash transfer and Empower program are given what is rightly due. Ruth Aguele has more.
In the face of COVID-19, efforts have been made by the federal government to ease the burden posed by the coronavirus pandemic. As beneficiaries of the conditional cash transfer and other palliative measures put in place for the poor and vulnerable in society continue to reap the dividends. In matching words with action and ensuring that nothing is lagging behind, the Ministry of Humanitarian Affairs, Disaster Management and Social Development recently terminated a contract of a payment service provider who defaulted in line with its contractual agreement.
So we felt it is unfair to the beneficiaries to keep prolonging this process while others are benefiting. The process has been triggered using the World Bank processes and guidelines, and we have decided to use the existing payment service providers that are already in the program and they have the capacity to deliver.
This action taken by the ministry, the minister says, would serve as deterrent to other payment service providers to live up to their obligation. On its part, in meeting up with its obligation to sustain the NPower program, the minister reiterates the immediate payment of stipends to beneficiaries.
The government has their interests at heart. I have I have approved for the payment. I'm sure before the end of this week, we'll be able to pay these stipends.
While urging citizens to support the government in the fight against COVID-19, the minister also noted that an overhaul of the NPower program is still in progress for an improvement in service delivery. In Abuja, Ruth Aguele, NTA News.
We'll now take sports update with Kene Magbodike.